What do you know about genital warts? What brings about them? What infection brings about genital warts? Is it a viral infection, bacterial, or even fungal? Whatever you know about genital warts, don't hesitate to let me know in the comment section. Also, like and share this video and subscribe for me if you've not done so yet. Put on your notification bells for new updates as well. Thank you. Genital warts, as the name suggests, pertains to the male and female genitals. Yeah, even though it can also grow in the mouth, on the tongue, and in the throat. Particular strains of human papillomavirus causes this, and so it is a viral infection. Like I said, it is a sexually transmitted infection which causes warts to form in and around the genitals and even inside the rectum. The rectum is in the anal area. Yes, it's inside the anus. So when you are infected with this condition, there is a cluster of bumps or growth inside the rectum and in the genital area. Other areas you can find genital warts are the groin, the scrotum, the penis, on the lips, and even inside the vagina, as I said. The mode of transmission of this infection is through anal sex, vaginal sex, or oral sex. Genital warts actually affects all genders, people of all ages, but it's most common in teenagers and in young adults. Yeah, your chances of getting it increase if you don't practice safe sex, that is engaging in sex without protection, and also if you have multiple sex partners. You may also ask if it's contagious. The answer is a big yes. Both the human papillomavirus that causes the infection and the infection itself is highly contagious, meaning you can easily spread it to others. I'm so sorry, my kids are home today and they are kind of worrying me here and there. So kindly bear with me if you hear any noise in the background. So back to what we were saying. The human papillomavirus and the genital warts are highly contagious. There is no cure for this condition, but you can get treatment for it. And once you get treated, it doesn't end there. You can still spread the disease to others, knowingly or unknowingly, because you have the human papillomavirus still inside of you. Why it happens like this is we don't cure viral infections, we only suppress their action. Genital warts also spread through genital touching, that is skin to skin contact without ejaculation. Yeah, you can actually have the type of human papillomavirus that causes the genital wart, but not actually develop the warts itself. That one is also there. You can have the human papillomavirus in you, but not necessarily get the warts around your genital area or any other place, but the virus lives inside of you. Because of this reason, it's kind of complicated if you have it and you would want to figure out which partner gave you the genital wart. If you are a person who engages in multiple sex, it's kind of complicated when you try to figure out who actually gave you the genital warts. The warts look like a rough skin colored whitish gray growth on the skin. They usually cluster together to form a cauliflower shape on the skin. Some of the growth too are flat. Occasionally, they cause bleeding, burning sensation, genital itching, or physical discomfort. How soon do warts appear after an infection? Some people develop the warts weeks after having sexual contact with a person having the HPV. Others too can take from months to even years for the warts to appear. And this is the reason why it's very difficult trying to figure out who gave you the infection or when actually you got it. So when it comes to diagnosing genital warts, these are some of the examinations healthcare providers do. First of all, they do a physical examination and biopsy, followed by a pelvic examination and a pap test. The pap test is to check for cervical changes. We also do a test called colposcopy. Then there's also anal test being done. The anal test is by the use of anoscope to look inside the anus for warts. There are treatment options for genital warts. Like I said, it can be treated, but it's not curable. Since it is a viral infection, we just manage it. Some of the treatment options are laser treatment. With this kind of treatment, a laser light destroys the blood vessels in the warts, cutting off their blood supply. We also have freezing, whereby a healthcare provider or a professional will introduce a liquid nitrogen to freeze the warts. You can also be prescribed certain creams and solutions to be used for several weeks. These prescription chemical solutions actually causes blisters to form under the warts, cutting off their flow of blood. Can someone have genital warts over and over again? The answer is yes. It is still yes. Because we don't have a cure for it, we can have it over and over again. Are there health complications? No. Generally, genital warts don't cause any serious health complications. This is because the type of strains of the HPV that causes the genital warts are low risk, unlike the strains of HPV that cause cancer. In order to prevent genital warts, please employ the use of condoms during sex. Get the HPV vaccine, get routine testing and any necessary treatment for any other STIs. Avoid multiple sex partners, avoid douching, and also let your partner know whenever you have genital warts so they can also be tested and treated. Remember, the treatment for genital warts is not a cure. So if you think you have genital warts, kindly contact a healthcare provider. I hope today has been great. If you enjoyed the session, kindly like the video, share, and those who haven't subscribed to, kindly do so and put on the notification bells for new updates as well. Until then, see you in my next video.